The World Health Organization has reached out to Beijing for more information regarding a recent outbreak of mysterious pneumonia in northern China, primarily affecting children. In an official statement on Wednesday, the United Nations Health Agency stated that they have made a formal request for detailed information on the rise in respiratory illnesses and clusters of pneumonia among children. China has seen a surge in cases of influenza-like illnesses compared to the same period in the past 3 years when strict measures were in place as part of their zero-COVID strategy. However, this policy was abruptly abandoned in December 2022. The WHO acknowledged that China's National Health Commission had previously reported an increase in respiratory diseases, attributing them to the lifting of COVID-19 measures. They also mentioned the spread of other pathogens such as influenza, Mycoplasma pneumoniae, and respiratory syncytial virus. Recently, ProMed, an online medical community that raised concerns about an unknown illness in Wuhan in late 2019, which later turned out to be COVID-19, highlighted a growing number of media reports about clusters of undiagnosed pneumonia among children in northern China. Taiwanese media outlet FTV News reported that children's hospitals in Beijing, Liaoning, and other northern regions were overwhelmed with sick children, leading some parents to question whether there was an epidemic being covered up by authorities. ProMed emphasized the need for more definitive information on this concerning illness. The WHO stated that it is unclear whether the outbreak in northern China and the overall increase in respiratory infections previously reported by Chinese authorities are connected. Therefore, they have requested more detailed information from Beijing on the situation. The WHO has asked for additional epidemiological and clinical information, as well as laboratory results from the reported clusters among children, through the International Health Regulations Mechanism. They are also in contact with clinicians and scientists in China through existing technical partnerships and networks. Dr. Krutika Kupali, a member of the WHO's emergency program, expressed on social media platform X that the illness could be anything, and that many countries have experienced outbreaks of respiratory illnesses after lifting lockdowns. She emphasized the need for more information about symptoms, epidemiology, and testing. The WHO has advised people in China to take precautions to reduce the risk of contracting respiratory infections, including updating vaccinations, maintaining distance from others, wearing masks when necessary, and staying at home when sick. Testing is also deemed important. It is worth noting that the first cases of what later became known as COVID-19 were initially reported as unexplained pneumonia in late 2019. The first death from the disease occurred in January 2020, the same month that China publicly shared the genetic sequence of COVID-19. Deeply concerned by the rapid spread and severity of the virus, as well as the lack of action, the WHO declared a pandemic in March 2020.